morning to everyone. Thanks for the introduction. Hepatitis delta virus is defined as a defective virus, strictly dependent on its cohelper, represented by hepatitis B virus, as it provides the surface proteins, HBsAg, for the morphogenesis and de novo entry into the cells of both viruses. Indeed, HBsAg interacts with the cellular receptor NTCP, thus mediating the viral entry into the pathocytes. And HBsAg is composed by 3 isoforms, different in length and deriving from the different start of transcription of the open reading frame S of HBV genome. These are large, middle, and small HBs. In particular, large HBs, deriving from the transcription of pre-S1, pre-S2, and S region, is present in mature variants, and it is responsible for the binding to the NTCP receptor. Middle HBs, deriving from the transcription of pre-S2 and S region, has a still unknown role in viral life cycle, while small HBs, deriving from the transcription of only S region, is present in both mature variants and subviral particles. And as Professor Zvika said before, so far commercial assays target and quantify only total HBsAg, and very recently new assays have been developed for the quantification of the different HBs isoforms. However, the role of these isoforms has been so far well investigated in the setting of HBV monoinfection, in particular in order to predict the achievement of EAG negative status in drug-naive patients or HBsAg loss in treated patients, but little is known in the setting of chronic hepatitis delta. And very recent studies have highlighted a different composition of HBs isoforms in the setting of in people with chronic hepatitis delta according to their clinical outcomes as well as to HDV RNA detectability in plasma. And in particular, our previous study shed light on the potential role of HBs isoforms in predicting response to bulevirtide, recently approved for the treatment of chronic hepatitis delta. So on this basis, HBs isoforms deserve a deeper characterization, especially in the setting of chronic hepatitis delta. So our study aims were to investigate and compare the composition of HBs isoforms in the setting of HBV monoinfection and HDV coinfection, and to investigate the correlation of HBs isoforms with delta replicative and cytolytic activities. To do this, we analyzed 322 serum samples from EAG negative individuals followed in different Italian centers, divided into 192 with chronic HDV coinfection and 130 with chronic HBV monoinfection. Classic serum viral markers such as HBV DNA, HDV RNA, and total HBsAg were quantified by classic commercial available assay, while ad hoc ELISA assay by Bickel were used for the quantification for different HBs isoforms. In particular, these assays showed an intra-assay CV under 10% and an inter-assay CV under 15%. Moreover, we also observed a strong positive correlation between our ELISA assay and the commercial one for the quantification of total HBsAg, with a raw value of 0.86. And moving on to the results, these are the characteristics of our study population. The two groups showed comparable age, sex, nationality, as well as percentages of individuals undergoing nuke treatment. HDV coinfection is characterized by high levels of serum HDV RNA coupled to elevated levels of total HBsAg, and despite low levels of HBV viremia. Moreover, HDV coinfection is also characterized by a more intensive liver inflammation as indicated by ALT levels and by a more advanced liver disease as indicated by the percentages of cirrhosis. Then, by comparing HBs isoforms in the two groups, we observed statistically significant differences with higher levels of all 3 HBs isoforms in the setting of chronic hepatitis delta, even by 1 logarithm. And multivariate analysis confirmed HDV coinfection status as an independent factor associated with higher levels of small, middle, and large HBs. Then, by focusing on 192 individuals with HDV co-infection, we observed a positive correlation of all HBs isoforms with serum HDV RNA, but not with HBV DNA, supporting a direct association of each HBs isoforms with delta replicative activity. And this result was confirmed also by stratifying people with HDV co-infection according to delta viremia. Indeed, people with HDV RNA levels higher than 3 logs of units on ml showed higher levels, increased levels of all 3 HBs isoforms. And these findings support the hypothesis of a different potential recruitment of HBs isoforms between delta co-infection and HBV monoinfection for the production of delta variants at expenses of B variants and subviral particles that result less represented in the setting of a highly replicative HDV. Finally, by focusing on lowly replicative delta cases, always defined as serum HDV RNA levels lower than 1,000 of units on ml, this represented 15% of cases, of delta cases. And despite a reduced viral replication, more than the half of them showed altered transaminases. And by analyzing HBs isoforms in this set of patients, we observed that, by our analysis, small HBs levels higher than 400 of nanograms on ml resulted to be associated with altered transaminases, with levels also twofold higher the upper limit of normal. In particular, around 80% of people with small HBs levels higher than 400 of nanograms on ml showed altered transaminases. And this result was also observed by analyzing middle HBs. Indeed, by our analysis, middle HBs levels higher than 200 of nanograms on ml resulted to be the best cutoff predicting altered transaminases. So, both the results support the potential role of HBs isoforms in reflecting cytolytic activity characterizing delta co-infection, even in the setting of a low replicative delta. So in conclusion, the levels of HBs isoforms are different between delta co-infection and HBV monoinfection and correlate with delta replicative activity, reflecting a different proportion of circulating viral and subviral particles between the two conditions. The association of HBs isoforms, in particular small and middle, with an enhanced cytolytic activity in the setting of chronic hepatitis delta, support the potential role of these isoforms in triggering pro-inflammatory stimuli. Overall, the role of HBs isoforms in modulating delta replicative and cytolytic activities deserves further investigation in order to identify patients more prone to liver disease progression in which antiviral treatment should be prioritized. I want to thank all the people involved in the study and thank you all for the attention.